Hi, my name is Ashley. I'm a Purdue student. I'm going to be your nurse today. So before I begin, I need to verify your identity for your safety. So I'm going to scan your wristband and then I'm going to check in the chart, okay? So I'm going to see your wristband. Okay, your chart says Sarah Kralik, February 23rd, 2001. Wonderful. I did create privacy for you, so you were the most comfortable, Sarah. I shut the door behind me and I shut the curtain behind me too. So I got my equipment and my emergency equipment. But this procedure that I'm doing is that I received an order from the doctor for trach suctioning and care for you today because you need to keep that trach stoma clean so it decreases your risk for infection. Now, if at any moment you begin to feel respiratory distress or severely uncomfortable, please raise your hand and let me know, okay? Let's begin. So I'm going to adjust your bed to about working height. All right, making sure you are comfortable, making sure you are not having any pain at this moment, okay? Bed is adjusted. I'm going to place a chuck on top of your chest. I did perform hand hygiene prior. After I place this chuck, I'm going to also take your abdomen too, okay? All right. I'm going to also take your abdomen. Okay, I've also tated your bowel sounds in your abdomen. Begin. I'm going to, like I did, I placed the chuck on here, and then I'm going to adjust your suction to about 100 to 150 mmHgs. So your suction has been adjusted. Next, I'm going to put on some clean gloves. Once on, I'm going to check your suction to make sure, to verify it is working, it is suctioning. All right, it is properly suctioning. I'm going to place a resuscitation bag right there next to you. And then I'm going to make sure your oxygen is at 10 to 15 liters. Okay, I have adjusted to 10 to 15 liters. Oxygen is still on you. Next thing I'm going to do is that I'm going to open my sterile suction package. I'm going to put the saline in first, removing my gloves beforehand. All right, making sure the package, I have a clean, dry area. The package, the date is valid, so I don't want to do any kind of products that are expired. So this one's good. Removing the package. I'm going to first place my saline in my basin. I can touch the outside, but not inside. Okay. With my saline solution, if already opened, I'm going to dump some out and pour in my basin. Okay. Solution is in. Set that aside. Next thing I'm going to do is I'm going to put my face mask and my goggles on. Okay. All right, my mask is on, securely on my nose. Putting my goggles on. All right. Making sure my goggles aren't going to be fogged up entirely. Next thing I'm going to do is I'm going to put my sterile gloves on. Making sure I do not contaminate the gloves itself. There we go. All right. Pinch and then apply gloves. Adjust as needed. Okay. Disposing. Next thing I'm going to do is I'm going to prepare the actual suction. I'm going to wrap it around my hand. Remove from package. Disposing it. Utilizing my dominant hand by wrapping around my hand and my non-dominant hand on the suction. Okay. This is ready. My solution is prepared. Next thing I'm going to do is I'm going to remove your oxygen and I'm going to give you 3 breaths. with my non-dominant hand. Okay, removing oxygen. 3 breaths. Ready? 1, 2, 3. All right. Right hand is still sterile. I'm going to dip in my solution. I'm going to begin suctioning, okay? Between each suction, I'm going to do about 30 seconds between them. All right, first time around, here we go. I'm not going to have my thumb on my suction here. I'm going to insert it now, about 30 centimeters. About 10 centimeters. 10 centimeters, not 30. All right, intermittently suctioning as I go, releasing my thumb. Okay, good job, good job. All right, I'm going to give you another 3 breaths. 1, 2, 3. I'm going to do this once more. Dip in my solution and come back, making sure that I do not have my thumb on my suction. I'm going to reinsert. Alrighty. So far, so good. Alrighty, Sarah, I'm going to give you 3 more breaths. 1, 2, 3. I'm going to put back on your oxygen. Next thing I'm going to do is that I'm going to suction your oral pharynx. I can do this now because I already suctioned your trach. Same thing. I'm going to dip my solution in my basin. I'm going to dip my tube into my basin. All right. I'm going to suction your oral pharynx. Alrighty. And that is complete. So now next thing we're going to do is that I am going to take off all of her dressings and take out her inner cannula. Okay. I'm going to reapply her oxygen here. I'm going to wrap everything inside my gloves and then dispose as properly. Perform hand hygiene. Next thing I'm going to do is I'm going to provide oral hygiene for you. Okay, I have performed oral hygiene. Next thing I'm going to do is that I'm going to prepare your suction catheter kit and reinsert a new inner cannula. Making sure my container is valid with its date. It is. Okay. What I'm going to do now is that I'm going to open up a new inner cannula and place it into my sterile field. Okay. Next thing I'm going to do, put some saline inside. All right. Set that aside. Next thing I'm going to do is I'm going to put on my sterile gloves. Okay, here we go, making sure I do not contaminate the gloves itself. All right. And then adjust as needed again. This one's real bad. Okay. My sterile gloves are on. Disposing. Okay, then since both of my hands are sterile, I'm going to manipulate inside my packaging. I'm going to put my Q-tips in the solution. Okay. Next thing I'm going to do is that I'm going to place the new inner cannula inside her stoma with my dominant hand. Okay, inner cannula. I'm going to remove the oxygen, insert inner cannula. Okay, her inner cannula is in, putting back on the oxygen. Next thing I'm going to do is I'm going to reapply some gauze. Well, actually, I'm going to clean the area first with each 4 quadrants, okay? So I'm going to clean 1 quadrant, disposing. Do another. So 4 in total. Okay, disposing. Okay. Alrighty. That's the 4th quadrant. Disposing. Then I'm going to replace her gauze under. But before that, I'm going to dab dry. Making sure surrounding area is dry. Okay. Disposing, then I'm going to place her under gauze. Okay. Okay. Next thing I'm going to do, I'm going to replace her collar. Removing my sterile gloves. Disposing them. Performing hand hygiene. Then I'm going to put on some new gloves. Okay. Then reapplying a new collar. Taking off the old and putting on another one. Okay. Alrighty, Sarah, I'm going to remove your old Trach collar and put on a new one right now. Alright. So unwrap the Velcro, slide out, put in the new one, same thing other side, unwrap, then I'm going to dispose of it. Alright, making sure it's secure. While doing so, I would have made sure that her stoma, her trach, would be secure each time I would remove too. So I have done that. Okay. Now she is all ready to go.